how to make stamp technique in case if occlusal surface of the tooth is destroyed or maybe affected by the old restorations. This is the new BG Dental Tips episode. Stay tuned and you will see everything step by step. Dear colleagues, dear friends, we are back with a new episode of the BG Dental Tips, and this time we will discuss an interesting approach and very easygoing approach like a stamp technique. This technique helps us to save a lot of time reproducing or copying anatomy from the tooth surface originally to after caries excavation and also to have less time spending for occlusal adaptation. So the original stamp technique is when you have the tooth of the patient with a caries defect, but the caries is relatively small or it's maybe big, but the occlusal surface is more or less preserved. So we can copy this occlusal surface using silicone materials or using the fluorocomposite or using liquid dam or whatever, and then you will reproduce it during the process of restorations, which is the original version of the stamp technique. But what we should do in case when your patient has, for example, old fillings or big caries defects and occlusal surfaces are not preserved to be copied and to be recreated or pasted into the patient's teeth. For example, like you have patient with with a request to do caries management or to replace the old restorations, and we have multiple teeth to be restored. So in this case, we can do also stamp technique from the model. You can actually have the first consultation, you take an impression or you scan, you send this to your dental technician, and dental technician may do a wax up. Okay, so this is not a case of the vertical dimension of occlusion increasing. It's just a simple ICP, like an intercuspidation case, like a habitual bite case. You ask your dental technician not to change occlusion in terms of the height, okay, but dental technician will equilibrate the occlusal surface, for example, if there is a flat filling, and he will wax up everything to be very natural and very anatomic. So then after that you will take an impression from the model, and imagine if you have a lot of teeth to be restored, your dental technician already did everything for you. So you have them fitted by the occlusion, anatomy is good, you can copy it with a fluorocomposite, with a liquid dam, or with a silicone, as I mentioned. In this case, by the way, I'm using the patent, not patent, but it is it's a special blue composite from Ultradent. Also can be utilized for this type of case. So we copy it from the model like a Ctrl+C, and then we will paste it into the patient's mouth in a case of the reconstruction. So that's after caries excavation, okay? And now we have to do some layers, some basic preparations like it should be for any direct restoration, etching, rinsing, bonding, okay, liner, maybe some layers of dentin composite, and then the last layer of enamel, for example, or body shade, it's up to you. You will stamp with a stamp technique, but just small tip here, you have to fit your stamp all the time, just to be sure that there is no interference between the stamp and the previous composite that you already placed. I mean the previous layer of composite that you placed. Okay, so the last layer of composite will be adapted to the first surface of the tooth, and you will use Teflon. You press it through the Teflon with a stamp. You remove Teflon, you can remove some excess of composite, and then you go with polymerization, and you get a result like that. So this technique may save a lot of time since you have multiple teeth waxed, okay, and you can just do copy paste, stamp, and all the occlusal anatomy will be copied from the dental technician's model. So that's the way to perform direct restorations, or again, since we live in 21st century, in a century of digital technologies, you can definitely do your preparation, you scan, you can design the restoration yourself. Nowadays we have also AI possibilities, then you can print the restoration or you can mill the restoration, so that will be indirect chairside approach, so it's up to you. I hope this stamp technique will be very useful for you. And again, don't forget to put likes to this video, to share it with your colleagues, and may the dental force be with you. See you next time.